And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And we've got lots of questions, so we're going to jump right into them.
Will do.
Our first question, can you still have a baby with fibroids?
I'm not quite sure. Probably reduces the chance that you will become pregnant. You know, fibroids being an anatomical defect of the uterus, anything that affects the uterus can potentially affect kids. I don't know exactly. Probably the chances are lessened, though.
Okay. How can you get rid of cirrhosis on your head?
Typically, topical medications such as steroid or immunosuppressants, which are used by the dermatologist, work very well. Sometimes we use systemic medications that affect the immune system.
Okay. Does a mole have to be surgically removed if it's non-cancerous, or if it doesn't appear to be swollen?
No, it can stay there. If you don't have a problem with it and it's non-cancerous, yes, it can stay there. Certainly that is always the concern, and biopsies are typically done because the mole is dark and it's flat. And if you remember, melanoma can sometimes look like that, and it's always everyone's fear, especially if you've had a lot of sun exposure.
Okay. This person has tried all kinds of different dandruff shampoos and nothing has worked so far. It's embarrassing. What do you recommend?
I would recommend get to his physician or dermatologist. He might need a medicated shampoo, a steroid shampoo. He may have a skin condition that needs more aggressive therapy than what's available over the counter. A biopsy might be necessary for his scalp to determine that, so certainly get to your doctor. Probably can be treated, just needs medicated medication.
Would it take going to a skin doctor or just your regular primary care physician?
Not necessarily. I mean, sometimes here locally it's so difficult to get in to see skin doctors. You know, try your primary care physician out first. We may not know the answer. Sometimes doctors are very comfortable treating skin conditions, especially if they see them frequently. So try them first. That's what they're there for. But if not, then get to your dermatologist for a later appointment.
Okay. This person says, I have heartburn like super crazy. I take
omeprazole.
Okay, daily. I'm out at the moment. It'll be for a couple of days before I get some more. I was told that I have a lot of acid in my stomach and bowels. What causes this, and should I be worried?
I don't think you should be worried at this point in time. No red flags. I don't hear any vomiting of blood, weight loss, always pain with eating. Those are serious red flag issues. If omeprazole doesn't work, try Tums, try Pepcid, try Tagamet, try all three. Certainly if it doesn't get better, get with your physician. Some of the prescription medications work a lot better. Certainly if that doesn't get better, I would probably recommend a GI evaluation for endoscopic evaluation. Make sure nothing else is going on. But it doesn't sound like anything too horrendous at this point.
Okay, this person has a torn ligament in their shoulder from a job injury. What can they do to help them sleep?
I think anything torn or fractured is probably going to cause severe pain. They normally need some moderate to severe potency pain medications, tramadol, hydrocodone, some topical gels such as Voltaren can be tried. But anytime it's torn, it's only going to be moderate to severe. I would get to your orthopedist, maybe get an MRI. It might need to be repaired. The longer you wait, the less that can be done, the more stiffness and problematic it can become.
Did I also mention that they have 3 bulging discs in their neck?
That's a lot. You know, bulging discs may not be a problem. We can do x-rays on 10 people and maybe find 5 who have bulging discs, but they have no symptoms. So we have to pair the symptoms with the x-ray finding, so he might not need any work for that.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person writes, collarbone and their clavicle has popped out. The orthopedic doctor says they won't perform surgery. Is there any danger, and what can be done about it?
I don't think there's any danger, especially if there's no pain. It might be deformed looking, and that might be the problem. Typically, if they don't meet surgical requirements, then no surgery is performed. We don't have to fix every fracture that we have in our body, and I think maybe the orthopedist is saying it's too high risk of a surgery. Let's just watch it for now, which is fine.
Okay. A woman feels lightheaded and dizzy and has some sinus issues. What could it be, and what can be done to get rid of the symptoms?
So many things. Lightheadedness can cause medications, anemia, low blood pressure. So she's certainly going to need to be evaluated by a physician, get some blood work, maybe some x-rays. If you think it's sinus, you can try over-the-counter medication, Allegra, Claritin, maybe some of the nose sprays to see if that alleviates the symptoms. But dizziness can be very troublesome getting a diagnosis because so many things can cause that.
Okay. This person was diagnosed with C. diff, starting to swell. Is that caused by the disease, or could it be something else?
Clostridium difficile, that's an antibiotic-induced diarrhea we talked about last week. Certainly, if you have a lot of diarrhea, you're not eating very well, it can cause protein deficiency, it can cause kidney failure, and so yes, you can swell. That's not a good sign. I probably would get in for an immediate evaluation, get some blood work, maybe get some fluids to make sure everything is okay.
Immediate evaluation, like go to the emergency room?
Today, yes,
today,
ma'am. I wouldn't wait, yes, until the doctor's office open tomorrow.
Okay, this person, what is a posterior tibial tendon dysfunction, and does it require surgery?
Not quite sure. Certainly part of the knee, I'm assuming there, and probably just doesn't work very well. Just a medical term indicating that. Could be a strain, could be malplaced or malpositioned. Certainly, again, just depends on the amount of dysfunction, the pain, the discomfort that's being caused kind of determines what's being done about it. Sometimes it can be treated non-surgically, sometimes not. Just follow up with the orthopedist.
Okay, my thumbs crack really bad, mainly in the winter. What causes this?
It's an unknown cause of a dermatitis. A lot of people get them mainly in smokers, more problematic in the winter. Typically, we have topical steroids, which help really well. Sometimes you need oral steroids. Stop smoking and keep your hands warm. If that doesn't improve, get to your primary care physician or dermatologist.
Okay. What causes nerve pain that moves around to different parts of your body? It started in my left arm, went to my lower back, then to my right arm, and now my right hip down to my knee.
Nerve pain, probably stabbing, stinging, discomfort, neuropathy, probably at the top of the list. So many issues causing neuropathy, diabetes, medications, sometimes poor diet can cause that, smoking. So just a plethora of things. Certainly going to need some blood work and maybe some x-rays, but there's good medication on the market such as Elavil, Neurontin, Lyrica that typically can alleviate those symptoms.
That word neuropathy that we all talk about.
It's very common, unfortunately, because of our lifestyle. I hate to say that, but I'll keep saying it over and over again. Our lifestyle puts us at risk for neuropathy a lot of times.
Okay. Is Depo-Provera shots healthy for kids?
I think anytime you talk about injecting a hormone, there's always a risk. So you just have to talk with your physician and weigh the risks and benefits of the medication. We rely very heavily on medicines in this society, but we always have to consider risk. So it has been around for a long time, but there's always a risk. So just talk with your physician.
I was wondering how someone would know about an RA and what blood test needs to be done.
That stands for rheumatoid arthritis, and there is a blood test called rheumatoid factor, or RAF, also called, there's a blood test called SED rate and CRP. That's typically what we start off with, as well as some x-rays depending on the patient's symptoms. That can be controversial a lot of times, the diagnosis, even amongst specialists. It can be frustrating for me as well as a primary care physician, so get to your doctor and get through the evaluation.
Do you need to know what blood test that you need to have before going into the doctor?
I don't have a problem with that. It makes my job a lot easier. The more educated the patient is, and you probably find some physicians out there that make them uncomfortable, but for me, I love it. I want patients to know more about their illness. It's going to make my job a lot easier, and they're going to be more successful with getting the right diagnosis, being on the right medications, having the right follow-up. So you need to be an advocate for your own health.
All right, Dr. Levine, as always, we appreciate you taking the time to stop by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFDM News Facebook page.